Hospitals across the valley have stayed busy caring for flu, RSV, and COVID patients, especially children. One hospital has a public plea to stay healthy because the surge is making staff sick too.
The hospital is stretched. We have been for several weeks. Surges in our COVID numbers and now increased numbers of flu and RSV patients.
As viruses have surged through households over the holidays and New Year's gatherings, locals have turned to hospitals for help. The Nevada Hospital Association says staffing remains at alert levels across southern Nevada. Chief Medical Officer of St. Rose Dominican Hospital Siena campus gives perspective.
Routinely pretty full in our pediatric capacity. We're frequently at capacity and actually holding patients in the emergency room waiting for beds, which is very consistent with what is happening with all the hospitals here in Las Vegas and Henderson.
As much as medical providers take precautions, the surges have hit them hard too.
Very much mandate that any of our staff who are ill stay home from work. But it can range all the way from as low as 5 or 6 up to 25.
St. Rose says those much-needed medical workers can't come back till they have a clean bill of health, but they've gotten adept at hiring travel nurses to fill the need.
Hospital is a 24-hour-a-day, 7-day-a-week operation. We can't put up a sign saying closed because of illness.
Hospitals and medical workers ask for you to help them. Wash your hands, stay home if you're sick, mask up in crowds, and get a COVID and flu shot.
People need to continue to think about others as well as themselves.
Also, hospitals like St. Rose advise you to use them as a last resort. Visit your primary care doctor or urgent care first.